The synovial membrane of the knee joint is extremely extensive. It's the most extensive synovial membrane that we have in the body. The reason being that we have a number of folds in the synovial membrane. And just like any other synovial membrane, the synovial membrane attaches to the articular margins of the patella, the femur, and the tibia, and lines the inner surface of the capsule. So where we've got on the medial side here, we'll have capsule passing from beyond the articular margin where this dotted line is, down to beyond the articular margin here where the dotted line on the tibia is. The synovial membrane will attach to the articular margins proper to the edge of the hyaline cartilage, comes down, lines the capsule medially before coming up and attaching onto the edge of the hyaline cartilage on the femur. Does the same thing on the lateral side, and it does the same thing for the most part posteriorly. However, there are a number of folds that are present within the synovial membrane. The first fold that we have is that anteriorly here, the synovial membrane will attach to the articular margins of the femur, and it attaches over here to the articular margins on the patella, so to the edge of the hyaline cartilage of both. But the synovial membrane, rather than going from femur directly to patella, it goes up and it creates a fold up here that goes underneath the lower quadriceps, the tendon of the quadriceps and the lower muscle itself. It's about 3 or 4 centimeters in height, this fold is, and this is known as the suprapatellar bursa. The function of this fold is to allow movement of the patella. So when the patella, when the knee moves into flexion, the patella slides down. This fold unfurls itself and allows allows free movement of the patella down into the intercondylar area. When the knee swells, fluid will pass into the suprapatellar bursa and often sits in there. So one of the things that we do clinically to assess for a swollen knee is we will apply pressure on the anterior lower quadriceps to push any fluid that's in the suprapatellar bursa down into the knee joint to actually evaluate the extent of swelling that we have. In addition to the suprapatellar bursa that we can see here, we also have 2 folds in the synovial membrane. So if we imagine that we've got this synovial membrane coming down here, and somebody has taken a pencil or a finger and pushed the synovial membrane towards the inside of the joint, they end up creating 2 folds that are like little finger-like projections that pass inward behind the patella, between the femur and the tibia, towards the intercondylar area. These are redundant folds. These are the alar folds, and are 2 leftover folds from when the knee joint used to be 2 separate joints. Posteriorly, the synovial membrane passes into the intercondylar area as well. So here we've got a superior view of the tibia and the patella anteriorly. We can see the patella here, so the synovial membrane will be attaching here to the edges of the hyaline cartilage of the patella. It creates the alar fold here. The synovial membrane then carries on round, attaching to the margins of the hyaline cartilage on the tibia, comes all the way around posteriorly. Now at this point here, the capsule goes straight across the back, so we've got a sleeve passing from femur down to tibia, but the synovial membrane leaves the capsule and follows the margins of the hyaline cartilage on the tibia all the way up to the front here, almost touching again with the alar fold, before going across to the anterior aspect of the anterior cruciate ligament, and then following the articular margin of the medial tibial condyle. This fold is to keep the 2 cruciates. The reason we have this fold is to keep the anterior cruciate and the posterior cruciate, although they sit inside the boundaries of the capsule, so are intracapsular structures, they are kept outside the boundaries of the synovium, of the synovial membrane, so are extrasynovial. So the 2 ligaments themselves are not bathed in synovial fluid. The synovial fluid that is produced sits in this space in here, in the medial tibiofemoral joint. It can move across through this little bridge that we have here into the lateral tibiofemoral joint, and it can move as well into the patellofemoral joint area. So it's one big joint cavity, but we've got these folds that I say they're often described as redundant folds, and I say they are folds that if the 2 condyloid joints were separate joints, each one would have its own synovial lining. Okay, we also have a number of non-communicating bursa. The suprapatellar bursa I've mentioned already, that we can see this fold coming up here between the quadriceps tendon and the anterior aspect of the femur. That's a suprapatellar bursa and is classified as a communicating bursa. But here we have a number of structures. Between the skin and the anterior aspect of the patellar tendon, we have the prepatellar bursa, and that allows skin mobility over the anterior aspect of the patella. Injuries of this are relatively common. They can be caused by impact injury, and an inflammation of this patella, of the prepatellar bursa, is often called the prepatellar bursitis or housemaid's knee. Here we have two bursae, non-communicating: the superficial infrapatellar bursa and the deep infrapatellar bursa. Inflammation of these bursae, extremely painful. These are often known as clergyman's knee. The other structure to note is there is a fat pad that sits between the tendon of the quadriceps down here, the ligamentum patellae, and the anterior aspect of the tibia. And this herniates out laterally either side of the patellar tendon itself. This is known as Hoffer's fat pad or the infrapatellar fat pad. The infrapatellar fat pad can give you a significant amount of pain if injured or inflamed. Being a fat pad, it's a very vascular structure, and as a result of which it does actually heal, it does respond to treatment incredibly well.